Medical practitioners are sending a stern warning, and this is over the unsupervised use of the anesthetic drug ketamine. Ketamine is used to induce a loss of consciousness and relieve pain, and can also bring life-saving hope for people suffering major depression or at a severe risk of suicide. But excessive dosages can also be addictive and even lethal in some cases. Let's discuss this further. I am joined now by Dr. Melanie van Zyl, who's from the SA Society of Psychiatrists. Dr. van Zyl, good to have you on the program this afternoon. So ketamine has shown promise for treatment-resistant depression, but can you elaborate on how it compares to traditional antidepressants in terms of efficacy and the speed of action as well?
Yes, it's very much different than antidepressants in many ways. One of the ways is that it's administered via a drip, so you get it in the vein, where other antidepressants you take as a tablet. It acts much quicker then because it starts acting the moment it goes into your veins. So it is more, you can say it is more effective. But it also goes with more risks, and that is why we don't give it to all patients with depression as the first line of treatment.
But what are the key risks that are associated with ketamine treatment, and how can these risks be effectively managed in clinical setting?
Well, ketamine it's an anesthetic, but it's also a drug. So the addiction potential is definitely there. Some people get addicted to it. It can be very dangerous. I mean, you can stop breathing, and it can also cause all sorts of, organ problems, organ failure, liver problems, etc. It can cause anxiety. It can cause you to become dissociative. It can worsen psychosis. So many possible side effects and long-term consequences.
I want to expand a bit on the side effects as well. Can you explain why unsupervised or even recreational use of ketamine poses such significant dangers, especially compared to its controlled medical use?
Yes, so it's an interesting drug, and the effects depend on the dose and the route that you administer it. Whether you give it in the muscle or in the vein. So it's important that it's administered by a medical professional such as an anesthetist or a general practitioner with a diploma in anesthetic, to be able to, act if there's a problem. If the blood pressure goes very high, if the patient stops breathing, it must be in the right setting where there's equipment that the patient can be monitored, everything, all the vital signs, and if the patient becomes upset or anxious, that there is a psychiatrist also on standby. So it's important that there's a very strict adherence to the guidelines when ketamine is administered.
As we continue to understand this drug, how do the effects of ketamine have on neurotransmitters like glutamate? How does it contribute to its potential as a treatment for severe depression?
Yeah, so ketamine increases glutamate in the brain. So that is what we know about ketamine at this stage. So still, it's been researched for quite some time, but the research is still ongoing. But the mechanism is an increased level. It increases the concentration of glutamate in the brain.
Dr. van Zyl, in light of the growing number of independent clinics which are offering ketamine treatment, what guidelines should be followed to really ensure that it's safe, but also that it's used appropriately?
So the South African Society of Psychiatrists, or SASOP, wrote a position statement together with the South African Society of Anesthetists. And that position statement can be found on the SASOP's website, or if you just Google ketamine position statement. So there are quite a number of points, but for example, only a psychiatrist can diagnose treatment-resistant depression. So it's not something that the patient can just decide that this is the treatment that they want and they go off and get it somewhere, So you must be evaluated by a psychiatrist. No matter where you present first, you must be sent for an evaluation to a psychiatrist. The psychiatrist should then refer you to the correct medical practitioner who's going to administer the ketamine. In other words, who is going to, give it to you in the drip. And then it must also be in the right setting. The clinic must have certain specifications. So there are many things that must be in place.
As we begin winding down our conversation, Dr. Van Zyl, what are the main concerns regarding the long-term effects of ketamine, and why is further research in this area necessary?
Well, to answer the last part first, sure. I would say it's we need lots more research, because it's already it's got a place already in our treatment toolkit, and it's going to become more and more available, and more people would we would want to use it. But we have to be very cautious how we're going to go forward, and really limit the potential side effects, such as addiction, and even so ketamine is short acting, so we need to give a number of treatment, but we shouldn't also just continue going on, giving. We should have other treatment plans in place, psychotherapy, what is going to, how we're going to treat and manage the patient most effectively, and not just continue indefinitely with ketamine.
Yeah. But how does ketamine's method of administration, we've spoken a lot about this. I make an example of intravenous versus nasal spray, for instance. How does it impact its effectiveness and safety?
Both those two routes of administration are very effective. And both have been approved, overseas and in South Africa for use. What is keeping the intranasal method back is the price, So that is unfortunately the problem. The intravenous ketamine is very reasonably priced, whereas the other one is extremely, extraordinarily expensive. So that is one of the big problems here.
There's also the argument that ketamine is not recommended for children, for instance. Are there any specific reasons why its use is limited to just adults with treatment-resistant depression?
I think it's just a question of research at this stage. It's just a trend. The research usually first on children, adults, due to ethical considerations. It's just much easier to do, from an ethical point of view, to do trials on adults. But I am quite sure, like with all medications, after it's well established in adults, they will do trials on children eventually.
And also given...
But at this time, it's not allowed.
Yeah, it's not allowed. Okay, so given the potential for addiction, we've also discussed misuse as well. What steps can healthcare providers then take to prevent these issues, while also using ketamine as a treatment as well?
Yes, I think there should always be a clear treatment plan. So we know that the initial treatment is between 1 and 6 treatments. That's the first the initial phase. The patient is evaluated after each session, so you don't necessarily need 6 sessions. And after that, some patients need maintenance, which can be once a week, once every 2 weeks, or even just once, or whenever when their depression returns. So it's very individualized, but I think, and that's the key message, your treatment should be individualized. You should always, as a patient, always see a psychiatrist who is really, individualizing your treatment for you, and not just saying, okay, it's 6, then it's 1 a week, that type of thing. Yeah. It should be individualized for you.
And as we conclude, what should patients and their families be aware of when considering ketamine treatment? How can they really ensure that they are receiving care from qualified professionals?
The quick answer to that is to have a look at the SASOP position statement. But the other answer is it must be ketamine is for treatment-resistant depression, and only a psychiatrist can diagnose treatment-resistant depression. So your psychiatrist should be the person initiating your ketamine treatment. So speak to a psychiatrist if if you think that is something that might work for you.
Dr. Van Zyl, thank you so much for your comprehensive overview, especially of the effects of ketamine as well, but also speaking to the safe use of this drug as well. We'll give you more news and updates in a short while. Do stay with us.